Hi, so today I'm talking about the origin of rotational vertigo, which we also call chakkar ana. Now, when a patient comes to the doctor saying I'm feeling vertiginous or dizzy, it could chiefly mean rotational dizziness or spinning. However, sometimes the patients also call a feeling of rocking and swaying, just like standing on a boat, as vertigo. And there are certain other types of vertigo as well. Sometimes they tend to have a blackout and they call it vertigo. They could just be feeling lightheaded and they might say they have vertigo. Or they could be unsteady and they say it's vertigo. The onus of finding out what exactly the patient is suffering from rests on the clinician. Now, the brain is using information from the eyes, from the muscle joint sense, and the ears all together to know what its orientation in space is. Now, the ears perhaps are the most important of these three. When they sense motion, they give signal to the vestibular nucleus on each side. These vestibular nuclei are trying to give information to the brain and also try to pull each other down simultaneously. What happens when you turn to a side? So when you turn to a side, the input from that side of the ear increases. That in turn increases the input in the vestibular nucleus, which by giving negative information pulls down the other. And therefore the brain is getting an increased stimulus from one side as opposed to the other, and it feels you're rotating. But the brain is very clever. It asks the other two things also, the eyes and the muscle joint sense, saying, what do you think? And the eye says, well, yes, I am moving. And the muscle joint sense is also moving, sensing that movement, and it says, yes, I'm moving. So all three inputs are the same as far as the brain is concerned. What happens when there's a problem in the ears? Now, when there's a problem on one side, that ear will not be able to send enough neuronal stimulus to the vestibular nucleus. Therefore, there's less inhibition on the other side, and the other side increases in neuronal activity. That in turn tells the brain that there's an imbalance, maybe I'm rotating to the good side, and it asks the other two. Now, the eye says, well, clearly I'm not rotating, and the muscle joint sense says, well, no, I'm not rotating. And the brain is getting complex, different information from different organ systems, which makes it confused. Now, a confused brain, which is being told by the ears that it is moving to one side, and it is told by the eyes and the muscle joint sense that it is not moving to one side, would tend to feel nauseous and might even vomit. And therefore, patients with acute vestibular dysfunction tend to vomit. When the patient visits the doctor would first want to confirm the diagnosis of vestibulopathy. We want to rule out that there is no central cause of this rotational dizziness. So the first bit would be clinical examination and then vestibular tests like VNG, VEMS or ECOG or VHIT. The doctor would give vestibular sedatives basically to make the ear go to sleep so the brain is not getting conflicting information from the ear and the eye. After a few days, the patient would put on vestibular rehabilitation treatment so that the brain can now learn how to use part function of the ear, the vision, and the proprioception together to make sure that the balance status is excellent. More about vestibular rehabilitation program in the next video. Thank you for watching the video by Dr. Malik's Prime Clinic on the origin of rotational dizziness. Thanks again. Have a good day. Bye.